Controversial topic we're going to talk about today. So I'm going to give you a very quick tour about what we know and don't know about the intracranial vertebral artery. It started really with Wepfer in 1658. And this was what Wepfer, he actually examined postmortems, looked at the blood vessels, described their appearance, and he was the first one who really talked about ischemia, bland infarct, and hemorrhagic infarct. This is what he said about the intracranial vertebral artery, kind of an elegant description. They emerge from the nearest foramen, that great orifice, go to the sides of the medulla, and then they join to form a single channel. So people started in the modern era kind of looking at various blood vessels. You know, Dr. Fisher wrote a lot about the carotid. There was ultrasound and surgery. There were trials about the neck arteries, the basilar artery by Kubik and Adams, and people were interested in visual function, so they did the posterior cerebral. But I did an analysis of PubMed from 1950 to the present of articles written about different vessels. And the first one up there is the intracranial vertebral artery. And as we go down, the intracranial carotid or posterior cerebral, the basilar, look at the carotid, but virtually nothing about the intracranial vertebral artery, which has probably been the least well-studied vessel around. And the way it all started was looking at the intracranial vertebral in lesions that were supplied by the vessel. The first one was Wallenberg, who was actually a primary care physician, and this is when he retired in Chicago. So Wallenberg knew his original patient. He had seen him before when he developed abdominal pain and then developed an infarct, and 6 years later published the postmortem, and you can see here where the lateral medullary infarct was. Here is the blanched vessel, blanched part of the brain, and here are the vertebral arteries. Now, although Wallenberg saw that the pica was occluded, actually the intracranial vertebral arteries were both occluded proximal to it, and for some reason the syndrome by some has been called the pica syndrome, but it actually was mostly a vertebral artery syndrome. And then my mentor, Miller Fisher, from youth to when I knew him on the right, did some studies with Kubik and Carnes, and what they did is look at the vessel, and you can see that on the left occlusion, and they drew where the medulla was. You can see the lateral medullary infarcts in B and C, and they concluded that the lesion was really the vertebral artery, which was blocked before these lateral medullary penetrators. And then Seipert and Alford really, in looking at cerebellar infarcts, most of them which were posterior inferior cerebellar, showed that the vertebral artery was often occluded, and when it wasn't occluded, there were mostly embolic foci. So then in the modern era, you've all seen the